Hello, everybody. Welcome back to Fridays with Dr. Frida. And today I have a gem of our community here. He did not want to come, but he understood that he needs to be here to explain to our community how important it is to take care of yourself. He is a physical therapist. He was actually also a mentor of my husband's. Whoever doesn't know, my husband is a doctor of physical therapy. And I want to introduce Boris Paltielov to all of you. Boris, thank you so much for joining me today.
My pleasure, of course.
So please tell us a little bit about what inspired you into physical therapy.
Well, initially, I came here when I was 15 years old. We went to high school. You're trying to determine what it is that you want to do, and I wanted to do medicine. I went to college with an idea to go on to med school, but I didn't want to just take biology or chemistry as my major. I decided to take something more serious, like physical therapy, and I also heard about profession, and it was very interesting. It's close to medicine, and so it was only a bachelor degree back then. And so I took that major. I finished it successfully, and I just needed a couple more classes to go further, to go to med school. So I already have the degree, I have the license. I decided, let me go work, and I loved it. I loved it, and I just decided to give up my dream in medicine. I just stayed with a physical therapist. So I love the profession. I love what it's about. I love what it does to people. I love how it helps people, and I enjoy it. And that's why I stayed, and been a physical therapist for since '99. That's 26 years.
I truthfully don't think you lost anything by not pursuing medicine, and I'll explain why. Because right now, physical therapy is considered a doctorate, right? You
Yeah,
are a doctor in physical therapy. I think with all of your experience put together, you are more of a doctor in physical therapy than many doctors that finish. And so,
experience does play a big role in it.
yeah, massive, massive. You have a ton of experience. I've personally gone to myself. I remember I had really bad vertigo one day. I woke up and I could just, my whole world was different. And I came to you and I just remember how bad it was. I remember vomiting in your office and you were just so patient and kind. I was so embarrassed, but you really are compassionate and I appreciate
Thank
that.
you.
You helped me a lot.
Of course.
So I really do want to say thank you. I don't think I ever did.
No, of course. Yeah.
Can you please tell me if you believe that with the proper care and the proper love and the proper work, the body can heal itself?
Of course. The body is an ingenious design. We heal. Our capacity of healing changes with time, but we always heal. And if provided a neutral environment, of course it will heal. Yes, I strongly agree in that.
How do you help people heal themselves?
So, quoting, I think Hippocrates said that you teach people about medicine. I forgot how it went, but it went something like you teach people about medicine how they do not how they will not need it, or something like along those lines. I don't remember the quote exactly.
How to
But
not need the
how to
medicine?
not need it, exactly. Yes, how to not need it. And that's what physical therapy is. We try to teach as much as preventative as possible, teach exercise that prevent further injury, improve biomechanics, improve posture. All of these factors will hinder quality of life, will hinder healing. So that's one of our goals as a physical therapist, to try to educate my patients in their lifestyle changes and other things that they could potentially cause them injuries. It's not necessarily only for the injuries that we have to treat them. It's also to prevent injuries in the future. And once they have it, we have to teach them why they got it, and what to try to avoid it in the future.
Right. So Jack tells me a lot about how you don't just have to go to physical therapy after you have a surgery, but you're supposed to also go right before that to prepare your body to heal and rebound faster. Can you tell me a little bit more about that?
Yes, so it's I highly recommend doing that. Jack's father, I don't know if I should mention it or not. So some of my clients that I see often in the clinic, if they are pre-surgical clients, I tell them we change the plan of treatment. We want them to get as strong and as flexible prior to surgery, so that the surgery so the post-surgical rehab goes much smoother, and with less complications, less discomfort, faster recovery time, faster functional return. It's very good to start pre-surgically, to start rehabilitation before you even go for surgery.
It's called prehab, right?
It could, there's many, there's pre-surgical rehab, yes, but not many doctors want to do it. Not many physicians refer because current healthcare is just, there's a limited finances, limited number of visits per insurance, so they rather save them until after the surgery than do it before.
Oh, I see.
Yes, unfortunately, it's not done very often. It's not, and it's not because it's not needed. It's just because there's a lot of restrictions of going about getting pre-surgical physical therapy. Most surgeries happen only after failed physical therapy, but it doesn't mean that patient will not benefit pre-surgical physical therapy specifically to, most importantly, get as much range of motion as possible and get as strong as possible, get all the muscles working properly before going for surgery.
No, I totally agree with you. How is it that it's so sad for me because I'm in the wellness field and unfortunately insurance does not cover these things. But how sad is it to you as a provider to see that people are willing to let the insurance coverage dictate their wellness, their health, right? Because if it's not covering them pre-surgically and they're not showing up, that's costing them their health because post-surgery, they will have a lot more issues. Or you could have even avoided surgery, but they never even referred to you, they never even came to you. And so you didn't even have that chance to help them at that moment.
So yes, it is a big issue, but it's a more of a global issue of healthcare in general, where it's going, how it's going. That it's a reactive kind of care, not preemptive. We do things after that happens and not before. Many injuries could be avoided if people seek special services or even aware of services. And I do see a lot of patients that have had surgeries that were, I think, were not necessary in in the first place. That had they had proper care, they would have avoided having surgery. But this is the healthcare now. You go with what you educate patients as much as you can. You get lucky if you get them in the right time. Sometimes you just deal with, you take things as they come and you work with them.
I hear you. I deal with that a lot. Sometimes people come to me with issues like breast cysts or masses or even sinus infections, and sometimes we get lucky and they'll come to me before they do anything about it surgically. Their doctors already tell them, oh, we need to do surgery for you. And sometimes they get lucky and they come to me and we're able to help them like this, and they can avoid all of that, the biopsies, the surgeries, the difficult times. But there's some times when I feel so terrible because these people come to me after 3 or 4 different surgeries, after going through so much, and they come to me and obviously I'm able to help them, but they've already gone through so much more. And then when they come to me, they're already in disbelief that anything can help them.
No, I totally agree with you that holistic medicine and the physical therapy could play a bigger role. But I don't, they should have doctors, medical doctors.
Absolutely.
I'm not discouraging them to attend to see consultations from medical physicians, orthopedists, whatever. I just wanted them to be aware of other practices that are out there that could be helpful. Unfortunately, they are not aware of that. And a lot of doctors, even doctors, sometimes don't believe in physical therapy, unfortunately. So
I hear doctors don't believe in what I do either, so don't feel bad.
no, I don't feel that.
Yeah. Can you tell me what is one misconception about physical therapy that you want people to know?
One of the biggest ones is it's just a massage therapy. It's not a massage therapy. I've been called massage therapist many times. Massage therapy is one of the things that we do, and it's usually myofascial release of some sort of a joint mobilization where we have hands-on contact with the skin. And some of it is massage therapy. We do break up adhesions, we do break up muscle spasms, but it's not massage therapy. It's also not personal trainers where we only do exercises. It's combinations of multiple things that we do. Physical therapy in general is we use of physical modalities. Everything related to physics we can apply in our practice. We use electrical stimulation as a TENS unit, and all of those physical agents have a specific effect on the body, and that's what we try. That's what we're known for. We know how to properly cause a positive effect on the body using physical agents such as heat, ice, ultrasound, electrical stimulation, vacuum, which is cupping, pressure, which is deep tissue and massage. Gravity is exercise. Everything we do is gravity. Like you cause an exertion, you add a little weight, but it's all exercise against gravity.
Yes.
All these things, traction, all these things are physical agents that are used in physical therapy. And we are skilled in providing this. We just not just massage therapy. So that's one of the biggest misconceptions. It's just we either do exercises or just massage therapy or just put electrical stimulation and heat packs and that's it. That's not really the case.
I hear you. I feel like in our community, especially, they see physical therapy as massage therapy and they go to physical therapy to get a massage,
Okay.
right? I feel like a
A
lot
lot
of
of
times.
clinics unfortunately do just provide massage therapy and call it physical therapy. It's not really it shouldn't really be done. But yeah, there's a big misconception that physical therapy is massage therapy.
Right. No, I think physical therapy is so much more than that. I mean, the different modalities used, the soft tissue manipulation, that's it's huge. It can change people's lives, and I've seen it.
Yeah, sure.
So, okay. So, can you tell us a little bit about chronic pain and how you deal with it?
Chronic pain is a big issue because unfortunately, what brings patients to the clinic is pain.
Right.
When they don't have the more chronic the issue is, the harder it is to deal with it. The longer it takes, very small increments of improvement. So frequently it is a systemic approach. There's something more that's going on just because since our body has a capacity to heal itself when something's not healing, there's something more than just an injury to a joint or an area. It's something more than that. So you have to approach it systemically. You have to address issues more than just a specific joint. For example, somebody with rotator cuff weakness can't lift the shoulder up. As a result, ends up with adhesive capsulitis. And all of that started with a slight impingement of the nerve in the neck because it caused some weakness in the muscles of the shoulder and the shoulder started not moving very well. Eventually, capsulitis kicked in and now they can't lift it up. So these things, like one leads to another.
It's
and
all a chain.
yeah, it's a chain reaction that, had it been addressed initially, might have been avoided altogether.
How does inflammation play a role in that?
Inflammation inhibits the body's response to healing. Even though it is a process of healing, when it's done, when it's chronic, and when it's persistent, I always have an analogy of an army. Okay, so if you have, and I don't know if I ever told you that, if you have a battle that you're going to, and if you have to split your army to 2 fronts or 3 fronts or 5 fronts, okay, the army gets weaker. You cannot win the war
Yes.
if you have 5 battles that you're fighting at the same time. So the more inflammatory processes that you have, and whether it's your gut, whether it's your other areas
Your
of your
liver,
body, yes,
your blood,
the likelihood of you improving in the shoulder is very low because there's not as much that your body could spare to try to fix that issue. So
Absolutely.
reducing generalized inflammation, healing, systemically, maintaining low inflammation throughout the body will get the body to heal faster in the joints if you ever get injured.
How do you suggest somebody help themselves if they have inflammation? Let's say they're coming to you consistently and they have this chronic inflammation, which obviously physical therapy can only do so much for, and it's systemic inflammation. How do you suggest for them to heal?
So we do work with I do advise them to seek medical help when needed. Frequently, if it's some kind of rheumatic inflammation, it has to be addressed systemically. So if somebody comes in the rheumatoid arthritis, for example, we send it back and go, or something weird that's like multiple joint involved at one time and there was no injury. We send them back to get to the rheumatologist to get it further assessed to see what's going on in the systemic. If the patient comes in and they had a specific injury and we able to evaluate and diagnose what has happened, what injury, what body part, what areas of the joints were involved, and we could start treatment right away. But unfortunately, sometimes it doesn't happen, or sometimes they come with a referral to just manage their pain. And at that point, we become them. We just help manage as much as possible to improve quality of life as much as possible, and we do maintenance therapy as well as restorative therapy. We restore as much as we can, so they could function, but yet they still have painful symptoms. We cannot get rid of all of it, and unfortunately, this is a chronic pain symptom. A patient with a chronic pain.
I hear you. What if I told you there were two things that you can give to your patients to help them? Would you use it?
Two things that go ahead.
Two things that you
Okay.
can give to your patients or recommend to them
Okay.
to help them with their chronic inflammation. Would you use it?
Of course. Why not? I'm always open for new ideas and new remedies.
So there is this amazing item. It's called red algae. It's a red algae, and what it does is it just reduces inflammation completely. And also, I don't know if you've ever heard of CBD oil. It helps as well with inflammation. Of course, you have to be very cautious with the liver, but the results that I see are incredible.
I will definitely consider referring them back to you, because
Okay.
not knowing a lot about those items, I wouldn't want to recommend something that I'm not aware I'm not an expert on. I usually would just refer them about, will notify them or inform them about this, these two items that you're talking about. But
Right.
because I'm not an expert in it, I wouldn't advise them on
I
using
hear
it
you.
without, proper guidance, I would say.
No, it's a great idea. Just send them my way and I'll help them out. And I always send people your way.
I know. Just this morning, you send me a patient pain, and we try to help him, but he'll have to come back again a few
Yeah,
times.
well, between the two of us, I'm sure we'll take care of him. Right. So tell me, please, how is it important for a person to have lymphatic drainage? Sometimes I know you told me that you don't specialize in lymphatic drainage. However, I'm sure that when people come to you and they do have issues with their lymph nodes and you notice that they have a lot of lymphatic backup, you take care of it. How important is it to take care of it at that moment?
So different stages and different reasons for lymphatic backup, or why someone would need lymphatic drainage. So somebody who had a mastectomy and has a significant lymphatic issue in the upper extremity, for example, I wouldn't work with that particular person, because there are specialists that would deal with such people. However, if you had an injury to a knee and you have swelling associated with that, it will all go into the tissues, and it will hinder the rehab. It will hinder the ability to improve range of motion. Strengthening exercises will be difficult and painful. So we have to incorporate lymphatic drainage to try to help them improve. Our goal is to return the joint to the normal quality as fast as possible. And one of the ways doing it, if they don't have swelling, they will improve mobility. So we would incorporate lymphatic drainage in our plan of care and our manual therapy techniques to try to help the patients. With such with these instances.
I see. So I know in wellness, for example, there are a lot of limitations. What I can do in regards to if a person doesn't change their lifestyle and diet, right? The way that they eat and what they do in their life. How is that reflective of physical therapy?
Lifestyle changes sometimes are very, very important to improve even with physical therapy. Somebody who comes in with a forward head posture, chronic neck pain, chronic headaches, poor eating, the issues will not improve even if we treat them and they feel better. If they don't change the way they do things, it will come back, and sometimes it will come back worse than it was before. You have to improve, and unfortunately, a lot of people don't listen. You tell them things, as soon as they feel better, they don't continue coming. One of the issues that I have is, even I told you, pain brings them in, lack of pain gets them out. So once they feel no pain, they feel like, okay, they're healed, they don't have any issues anymore, and they don't come back for the clinic. Unfortunately, sometimes it needs more time. They need to be further educated, and stabilizing muscles have to be strengthened. Certain muscles still has to be stretched, and further education needs to be provided to the patient to try to prevent reoccurrence. And this is sometimes requires a lifestyle change.
And then they come back when it reoccurs, right?
They do come back when it reoccurs, and it says, "Oh, why did it happen? I told you. Well, did you do this? Did you do this?" And none of that happened. So second time around they listen, but again, it's a human nature.
Yeah.
We don't take care of things until sometimes we have to.
Yeah. I see that very often. People, they really put their health on a back burner. They find other things so much more important, like working and
Well, it is important. It's just
it is important,
can't
but
exactly.
how much better will you work if your health is good?
Of course, efficiency, yes.
Right.
Of course.
If you're not healthy and you're not able to focus and you're not able to think clearly or have the full energy, right? Like you, for example, how much physical energy and mental energy do you have to input into being able to be a good practitioner?
Of course,
right?
yeah.
And if you're not taking care of yourself, if you're not physically taking care of you, how will you be able to see the amount of clients that you need to be seeing every single day in order to be able to work on your field? So I think it's really important people are not understanding that, and people are leaving everything on the back burner until they really get burnt out.
Exactly.
And there's nothing.
It's very happens very often.
Yeah, unfortunately, I see so many people that are wealthy, that have achieved everything, but now they're paying for their health because they didn't take care of their health as they were growing,
It's a good opportunity for them to do that because they are able to. Most people are not wealthy and can't take care of their health. That's a more problem.
That's a big problem.
That's a bigger problem.
No, it is. It is an issue. And people, listen, there are different types of people, right? People that do have money and don't take care of themselves. People that don't have money and will do everything to take care of their health. I've seen that as well.
Exactly, yes. Yeah.
So there's different types of people, different types of priorities, I guess you could say. And how about you? Do you take insurance?
Unfortunately, I stopped taking insurance. I still work with some insurances like no fault and workers' comp, and I take that because there's an opportunity of the number of visits that are allowed through those two insurances, that you're not limited by number of visits per se, and you could treat multiple body parts at the same time. But I came out after COVID because I couldn't get staff to work for me. I couldn't get enough good practitioners to work for me after COVID, and we had to cut down on number of patients that we see on a daily basis. And the only way for me to do that is to stop taking insurances, unfortunately, yes.
How do you think that made your practice better or worse?
It made my practice better for me. I've always tried to value quality over quantity. With a reduction in a lot of my patients, unfortunately, they're very upset with me that I don't work in insurance. I totally understand them, but right now I'm able to spend more time with each client, and the quality of treatment increased. The quality of treatment itself improved. Simply for the fact that I could spend more time with them. And if I think any physical therapist the profession is a very noble profession. We try to help people. Unfortunately, we are pressured to see a lot of patients over a very short period of time, whether it's our bosses or whether it's insurance companies, whatever it is, and we can't give as much attention as necessary.
1,000%. I agree with you.
Yes, so that's why I think that my practice improved since I stopped taking insurances. I make it very affordable for people to come and see me if necessary. And I stay within Queens area. I don't move to Manhattan or something like that just because I want to make it affordable.
In your mind, it's affordable, but I'll tell you, I came out with this product, which actually also really helped my vertigo. Came out with this product. It's eardrops. These eardrops are absolutely magical. People don't use antibiotic when they have them. Takes away ear infections, helps with vertigo, helps with tinnitus, helps with ear fungus, any kind of itching. And I asked a few pharmacists if they were willing to put it into their pharmacies. And some said yes, and some said no. And their response was that people are not even willing to pay a $3 copay. Do you think that they would pay $65 for these eardrops?
I believe people will do once in need, they will do it. But most will not consider it unless they need it. Unfortunately, it's like I said, pain what gets them into the clinic. So if they have pain or discomfort, and you tell them, okay, this is something that will help you a lot, they will pay for it, and they will take it and they will use it. But they have the pain, they won't take it. That's what my opinion is.
I hear what you're saying, but in terms of these eardrops, right? They go to their doctor, which is covered by insurance, and then they'll go to the pharmacy and they'll prescribe them antibiotic. And they don't really have the education or understand how bad antibiotic is when you're taking it consistently and unnecessarily. And they'll get it with $1 copay as opposed to getting the eardrops. So yes, I agree that you might be making things affordable, but it really just depends on who the clients are and how affordable they think it is.
Absolutely, yeah,
Right.
yes. No, of course, for some people, even whatever I charge is expensive.
Exactly.
And yes, it makes sense. But again, we do have bills to pay. We all do, and there's certain. Even though sometimes we do pro bono, I do a lot of pro bono. If a patient comes into me, can't afford it, I'll spend some time with them, educate them, do a session. Sometimes 1 or 2 sessions also. They completely can't afford it, but that's not my common practice, because they do have to understand that there's things involved in providing care that
Of
cost
course.
money, and we can't. It's not socialism, unfortunately. Or fortunately, we still have to charge for our services, because there's things that cost money for us to even provide those services.
1000%. A lot of people, they don't understand that when they pay a certain amount, it's for certain quality that they get. I'll give you an example, from dentistry, because I'm also a dentist, and I'll tell you is a dentist that gets half an hour to do one procedure, no matter how good he is, will never do the same type of work for somebody if they get half an hour as opposed to an hour. If they get an hour, they will do a much more
Of course.
beautiful and better job
Of course.
for somebody as opposed to getting half an hour. And I don't care how amazing they are, even if they're the best dentist in the world, it's the time component,
Of course,
right?
Of course.
It's
Of course. It's simple. Yes.
yeah,
Yes.
and
The
it's
more time you have, the better quality of work you will provide. Produce.
exactly. So when people are paying out of pocket and that provider can see less patients but give them more focus, give them more
Of course,
quality.
it works every time in any practice.
Exactly. I don't know about you, but I treat every single one of my clients as if they're my only client, and that's the way they feel. They'll probably text me any time of the day or whatever,
It's great.
and I make them feel like they're the only ones, even though I have, a ton of clients that I'm responding to, but I make them feel like that, and the reason is because I'm choosing to do quality over quantity.
That's good. That's the goal. Yes.
Yeah, so that really is the goal. And I just want to ask you now, how do you handle difficult clients?
Thank God I have a lot of patience. People say that, oh, the amount of patience that you have. I'm just very patient with them. So that basically solves all my problem. Be patient with your client, and there's no difficult clients. It's just, if you're patient with everybody, you're fine. You'll be fine.
You're patient. Have you ever fired a client?
No,
Never.
never. I've had a client this week who said, "Oh, I said such bad things, and you should just kick me out." I go like, "Why? You came here for me to help you. I'll help you." But I was negative to you. I was, after the fact that I treated her, she was a little bit apologetic of the way she behaved. But no, absolutely. If patients needs my services, I don't care. They're difficult, they're hard, easy, whatever. I have enough patience for everybody.
That's so
Yeah.
so good. You're better than I am.
No, I never let go of any client for them just being difficult. No.
Well, when I say difficult, I mean maybe ungrateful.
We have some of those, but no, you still provide the best care you can. It does not, if they don't believe my care, they won't come back.
That's true. That's exactly true. I agree with you. So when you work with your clients, do you ever do any kind of breathing work with them, stretching? What do you normally do with them?
Well, stretching is a big component. Manual therapy is a big component. We do incorporate some deep breathing techniques when there's pain involved, Because some of the things that I do is very painful. Say PT stands for pain and torture.
I like
And
that.
no pain, no gain. Yes, but so we do incorporate breathing to help with pain management while they're going through therapy. And yet, if they can't, if they can't manage pain in any way through breathing techniques, there's other techniques, or we just reduce the intensity of pain. It just sometimes the patient wants to get better quicker all the time. They want, oh, how long, how fast? Like 2, 3 sessions. How long do it take? 2 weeks, 1 week. So they want to be better the next day, obviously. And we try to do the best we can. Sometimes it requires for them a more painful approach, because when we break out the adhesions or try to range the joint, we have to go a little bit past a certain line. And the more we get, the better they are the next day. The less work we have to do, totally. So breathing techniques and techniques such as we tell them to meditate, we tell them, we give them, what's that technique called? It's called suggestive therapy techniques, when they talk, think about sky, think about clouds, think about the
beach.
The beach, yeah, think about the pain as a large cloud that it's leaving them and all that stuff. So all of those techniques we use to try to reduce pain sensation within pain and to help them tolerate therapy better. Breathing is one of them.
How do you breathe? Can you show us an example?
I breathe? I don't breathe properly, so don't let it, because my thing is all about core. So when I work, I activate my core muscles. So my breathing is through the chest, not through the belly. When I teach them to relax, I teach them to breathe through the belly. But when I'm physically working, and one of the most important things in back pain, for example, is having very, very good core and flexible hips and knees. So I'm always tense in my core. So I never breathe through my belly. I always breathe up top, which is not great. But
what about when you're not working? Do you ever stop and breathe your belly?
When I try to relax, when I'm in a sauna, okay, when I'm in the steam room, I would breathe deeply, because I want all that positive energy, and I want all that, negative. I want that interchange. So I would do it at that instant. Or if I'm really trying to, that's when I do it. But normally, no, I wouldn't actually do it.
Isn't it interesting how much knowledge we can have, but how difficult it is to apply it?
Don't do what the doctor does. Do what the doctor says.
Right?
Yeah.
I see that all the time. Tell me, what do you see that people are doing that is actually hurting their posture?
Currently, the use of cell phone is horrible. I had a grandma come to me with neck pain. She said, "Oh, she's been having for weeks." She said, "I have back pain." And then during the waiting room, I'm just observing her sitting in the waiting room and playing the Candy Crush game.
Really, a
Okay,
grandma.
and I ask her daughter, I go like, how many hours a day does she play Candy Crush? And this is grandma. She's like in her 70s. She goes like, she plays it all day long. And this is the couch fractures of oh, of course her neck's gonna hurt. She goes like, I can't cut food and I have to, my back is burning. I'm like, you playing Candy Crush 6, 7 hours a day. Of course it's gonna hurt. And this is very poor posture. So phone use in kids and adults is horrible. And this is one of the biggest things right now, I think, with posture and neck issues and back issues, is use of phone, use of cell phone.
When you say that, gadgets in general are really destroying the society. I mean, there's positives to them as well, right? But I actually have parents consistently calling me and telling me how video games are causing problems with their kids. I actually had a mom call me and tell me how her child felt like he was unreal due to playing video games all day long for about 3 years. And he developed a dissociative disorder where he felt like he was not in his body. He was feeling an out of body experience the whole time.
Oh, okay.
Yeah. So
it's like almost from a movie, but okay.
It exists. Yeah. I mean, I had other people tell me as well that their kids, don't want to go to school. They just want to sit and play video games all day at home. So it's really,
There's a problem, yes. I mean, my kids, I don't play video games, but they do watch too much YouTube.
Yeah.
Scrolling through YouTube and I don't like it either, but there's only so much that you can do to stop them.
Well, make sure they watch this podcast.
No, they will probably. They're going to want to see it.
So if you would like for somebody to do a full body approach, basically physical therapy and natural medicine, how would that look to you?
I actually started offering a service in my clinic, which is it's you've heard of Stretch Lab. Okay, Stretch Lab is done. It's a great idea. I think it's awesome because it's not related to medicine. It's not really, no doctor has to refer you. You just go to Stretch Lab to feel good, just like a lot of Pilates studios and other gyms and memberships, all that stuff. That's great. So I think it is helpful in maintaining functionality of the body. I started offering services in my clinic,
Amazing.
which is to my clients that have undergone through physical therapy and now feeling very well and feeling better. But in order for them to maintain it, if they wanted to, if they choose to, I educate them how to stretch themselves. And once a month, they come into the clinic, and I would stretch them, and I would stretch almost the entire body from head to toe. Most joints, most muscles are going to get stretched, and I'm going to teach them how to stretch most important ones independently or between sessions. And that's my whole body approach of somebody who's fairly healthy, and we want to keep them as healthy as long as possible.
I'm curious about this one. Who do you think, which profession of people that have come to you is physically the most messed up?
Well, dentist is not it's high up there, unfortunately.
Dentist, right?
Dentist is very high because of you can't really change the way you do things. I advise somebody who's a dentist to
Loops.
use loops.
You told me that when
Yeah,
I remember when I was
because
still back in the dance school.
because having your neck flex, standing up with using one upper extremity for 8 hours a day, it's very physically straining to your body. Okay, and so you do have to go to the gym, exercise, be fit, and try to work as much as possible to try to prevent these deficiencies, postural deficiencies that could be harder to treat later on.
Strengthen the core, I think, right?
Strengthen the core, strengthen all the stabilizing muscles of the neck, stretch, keep your shoulder blades flexible, so you keep your hips and knees flexible, so you could do it in sitting and standing, alternate, use loops where you don't have to bend forward, but you either use loops all the time or you don't use loops, because you can't switch them, because once you start using the loops, it will be hard for you to use. You'll have to be retrained.
So dentists that are currently working, like currently finishing school, I mean, since I graduated, we're always using loops. And
right now okay, very good.
the reason is the amount of perfection and the amount that you can see with loops. You could be doing the same procedure without it, and then you put the loops on and you have so much more work to do.
There you go. See,
So
it's not just, it's actually beneficial for the professional dentistry itself.
Exactly. It's beneficial for that, perfectionism, for to be able to see those little details. But then there's sometimes that you have to take the loops off because it's bringing you too close and not allowing you to see the full picture. So let's say when you're doing veneers, right? You can't consistently have them on. You have to take them off and put them back on so you can see the full smile and the full picture of the person's face and see how well it looks together.
I'm sure you could take them off to look overall. Yes.
Yeah. No, you do. So, can you also tell me, please, if I sent you a client, what would you want to know about their health history before working with them?
Well, most of my clients come to me due to some sort of trauma. Most of my clients are right now musculoskeletal disorders. I don't do neurological patients for quite some time already, but sport injuries, musculoskeletal disorders, arthritis, general joint pain, injuries to any joints. So we would want to know what happened. How did they get injured? We try to know as much about their prior medical history as possible, whether they have a pacemaker, whether they have the defibrillator, whether they had some kind of, God forbid, cancer or something like that. So all of those factors are very important. Interventions are very important, whether they had surgeries, whether they had injections in those joints. It's very important to know, because if every time a patient has an injections into a tendon, for example, the tendon is more brittle, so you can't stretch it as aggressively as you would with somebody who's not. All of those factors are very important for us to know, so we would want to know that. Somebody has diabetes, somebody has high blood pressure, all these factors are important in prescriptions, so you can't overwork them, or you give them frequent breaks. You be on checkout so they don't become hypoglycemic while exercising. All of these things are very important in prior to initiating physical therapy, and it's all addressed during initial evaluation procedures, like during a questionnaire.
I see. So
During question, when we question a patient. Yeah,
you work a lot with the geriatric population too, right?
I used to. Since I stopped taking insurances, my geriatric populations have declined significantly simply because they can't afford it. I do still see some geriatric patients on a self-pay basis, but I used to, most of my patients were geriatrics before pandemic.
I see. So in general, what are the age groups that you see most often?
Right now, most of my clients are middle-aged working individuals, yes.
And do you see that they're on a lot of medications or?
No, I don't see that many people that are on extensive list of medications. We do have on initial intake, we do ask them what medications they are taking, and most of them don't take a lot. These are, like I said, it's a little bit outside of norm within my clinic because I don't see a lot of geriatric patients. I used to have lists that would take 2 pages to fill of medications, and it would be hard for me to go through each one of them. I'd be like, wow, this is a lot of medications. It's like a whole pharmacy. I used to have that a lot when I used to see geriatric patients. Not so much now.
So when you see these middle-aged clients, patients, how many medications would you say most of them are on?
Most of them take they don't take many medications because these are again working individuals. These are again individuals that are proactive in their health, that are willing to spend the money to get the services they need. So I wouldn't say that I get the type of populations that just thinking about everything that they, unless I have a patient who has a chronic disease, for example, like a diabetes or some rheumatoid arthritis, they are on medications.
I hear you.
But most of my clients are generally healthy and had sustained some kind of injury, and that's why they're coming for therapy. They do take sometimes painkillers, sometimes they take herbal medications and vitamins and all that stuff.
Beautiful.
Yes. So I'm lucky in that sense that I do see a more healthier in the clinic right now.
You're not lucky. You purposely arranged it so because when you went away from insurances, your target demographic became people that care about their health because people that don't care about their health are not going to pay for it, right?
No, the people that don't care about it, well, if you put it that way, I think there's nobody that doesn't care about their health in one way or the other. Whether they can afford to help themselves by means other than insurance company, that's a different question. So I changed myself out of that demographic for reasons that, yes, for many reasons. It's likely that I changed it. Whether that was in the intent, no, it wasn't. But it happened to be, yes.
Okay. Can you tell me one client story, success story that you're really proud of?
One particular client success story. There's many. I mean,
choose the best one that you want us to know about.
I don't know off the top of my head. There's many. I mean, just most recent patient came to me, and this is not the best. It's just the most recent that I can recall. He had sprained his knee, had a partial tear of his meniscus, had an MRI done to diagnose the partial tear. Went to an orthopedist, knew me from before. Came back to me, called me out, can you examine me and all that stuff? I said, of course, come in, I'll examine you. Paid for his sessions even though he had insurance, and avoided having surgery to his right knee. He needed to have surgery. He scheduled surgery to his right knee, but did not need surgery after about 3 to 4 weeks of treatments.
So how do you fix something like that? Let's say a tear comes in. How do you address that so that he can avoid surgery?
So luckily his tear wasn't a tear that impeded joint movement. Okay, he didn't have a loose body within the joint that you have to remove. It's like having a pebble inside your shoe. You have to remove it, otherwise it's still going to be uncomfortable. Some tears don't heal, some do. He had the type of tear that might have potentially healed if it's not the movement. And we were able to basically improve the quality of movement within the joint by doing joint mobilizations, improve the blood flow to the area by doing cold laser and ultrasound treatment, reduce pain, improve strength so that and reduce load through that area of the joint. He was bracing for a little bit. He used the brace. And then his treatment was very successful.
Amazing.
Avoided having surgery, so that's as successful as you can get.
That's a big deal.
Yeah.
It's a big deal. Can you tell me, what do you do for your own health?
What do I do for my own health?
Yes.
I do take vitamins.
Good.
I don't do intermittent fasting, but I do fast over the last 3 months. And you said I lost weight. Over the last 3 to 4 months, I've been fasting for 36 hours.
Amazing.
Water, I drink water. You have to take electrolytes as well. But I've been fasting for 36 hours every week, once a week. Usually it's a Monday. Yesterday was a fast, so I just took that opportunity to fast. Not on a Monday.
And how do you feel?
I feel great. The most difficult things is the night after 24 hours, which is I just usually have a dinner and then don't have anything until the following days, the day after's morning. So it's skipping that dinner after 24 hours. That's the most hardest thing to do. But once you skip it on, for example, I fast on a Monday. So if you stop eating on a Sunday night, a Monday evening is the most difficult meal to skip. You really want to eat. But Tuesday morning, you don't even feel hungry. You could have a small meal, small breakfast, and you feel fine. And it's weird, but yes, it's very important. Tap into your body's ability to heal. Having excess food sometimes hinders your own body's ability to heal. On a cellular level, even there's I forgot what the concept is called, but the cell would heal itself or get rid of
Inflammation.
Not inflammation. No, it's when a cell would kill another cell, which is weaker. It's nature survives. So a healthier cell would get rid of the weaker cell, but it can only do that when there's a need for nutrients. And if you have excess of nutrients, excess of food all the time, that will never happen.
Mm-hmm.
So that's why I think fasting is good. Very good.
So you feel clear-headed?
I feel very good. I feel much better than I did before. I lost about 15 pounds and I feel stronger. I feel good.
Good. I'm glad to hear that.
Yeah.
I mean, you look great. You look
you.
like you lost more than 15 pounds.
Thank you.
So I'm happy it's working for you. Yes, fasting is amazing, especially when we're talking about cancer.
Yeah.
You know, it does kill those weak cells, as we said, and doesn't allow them to replicate because it doesn't feed them the nutrition that they like, which is sugar and other things. So can you tell me what is next for you?
I don't know. But time will tell. I'm going to continue working. I love my job, so I'm not planning to retire anytime soon. It is very physical and demanding on the body for myself. And one of the ways that I maintain, like not just fasting, but also stretching, doing regular stretches every day. I don't physically work out a lot, and simply because I have a very physical job and it's hard to do. But that's no. Like I said previously, do what the doctor says, not what the doctor does. I see myself trying to help as many people as I can. I don't see myself expanding, unfortunately, in any future because I've been in the practice for over 25 years. There's some other interests for me that I want to explore. But right now, I don't know what the future holds out for me. Right now, take one day at a time.
You're doing great as it is.
Thank you.
Thank you so much for joining me. Whoever doesn't know Boris, you really should visit him at least once just to get that stretch, to feel amazing. Like we said, just to get that stretch in, you know, everybody needs that. And if you want to visit him, he is on 108th Street, right?
Yeah, not too far from 108.
In Forest Hills.
And the Yellowstone on the 4th, yes.
So thank you so much for coming and joining
My
us.
pleasure.
Thank you for all this information.
Thank you, and keep up the good work.
Thank you so much.